The most common malignant tumors that we diagnose in the brain are tumors that come from other places. So metastatic tumors typically have the highest prevalence when it comes to lesions within the brains that we consider malignant. And they can be typically the most common ones being lung, as well as in the male population, prostate cancer, in the female population, breast cancer, and of course thyroid cancer, and sometimes even renal cancers can go to the brain. The next category that we talk about are primary brain tumors or primary brain cancers that grow from the brain themselves. And unfortunately, the most common one that we diagnose in our population is the most malignant, and that's termed a glioblastoma. A glioblastoma typically is a WHO, meaning World Health Organization, grade 4, being the most aggressive primary brain tumor. And then the grading scale does decrease in terms of becoming a grade 3 or a grade 2 or grade 1, which are also primary brain tumors, but typically not called cancerous. The most common symptoms that patients present with regards to brain cancers are sometimes headaches, headaches that prompt patients to come to the emergency room, headaches that are out of the ordinary, seizure activity, and of course, any sort of a stroke-like symptom that we're familiar with, whether it's weakness, numbness, changes in the face, meaning a facial droop. Slower growing brain tumors can cause cognitive decline over a long period of time. Similar in terms of vision, meaning if there are tumors that are close to the visual pathways, they can cause visual deficits, whether it's acuity or even visual field deficits. If there are focal signs, whether it's weakness or numbness or even a facial droop, or there's been a progressive cognitive decline or acute vision changes, you absolutely should follow up with your doctor so that they can refer you or get the appropriate imaging. The treatment modalities in brain cancer have been able to extend life quite a bit, meaning that depending on the type of cancer it may be, whether it's a metastatic cancer or a primary cancer, the modalities in surgery as well as in radiation and chemotherapy have all strived to extend life. So whether we're talking about the most malignant primary brain cancer like a glioblastoma, or we're talking about possibly a lower grade glioma within the brain, in all aspects, we've been able to extend life, so there remains quite a bit of hope in continuing that trend.